Just going to give everyone a couple more minutes. Sometimes it's not easy to change from one meeting to another. But thank you everyone for coming. I know that everyone has been in Zoom meetings a lot these days, and it's not easy to come during lunch hour, but we really appreciate everyone coming and spending some time with us today. I'm just going to start while people sort of trickle in. My name is Joanne Sohn. I am the associate professor in the Animal and Veterinary Science program. I'm also the director of the Veterinary Technician program or the Veterinary Nursing program here. We are excited to have you. Normally we have events such as Spa Day and Vaccine Clinic twice a year. And this is where we provide, fairly cheap vaccines as well as free spa services for our Cal Poly community. But of course, during the pandemic, we're not able to host that. So we just wanted to make sure that we still had our hands in the community and you were aware that we're still around. Today, what we're going to do is we're just going to have fun, celebrate our animals. I know that for the first time in history, all the shelters are empty because people are spending time with their animals. So there may be a lot of questions. We're going to show you a little behind the scenes of a veterinary hospital. I think people, especially nowadays with curbside drop off, you sort of take your pet to a black hole and have no idea what's going on. So we're going to give you a little behind the scenes look. We're also going to give you tips on how to keep your pet safe during Valentine's Day, and then a panel discussion and more. So thank you for coming. What I'm going to do is I'm going to actually introduce a couple of people who's going to speak today. One is Sachin Trivedi and Lee Flores. Sachin Trivedi is actually the CEO and chairman at the Pet Pit Stop. And Lee Flores is the manager at SoCal Vet Group. And I think Lee actually did a great job to show us a video of what happens in the behind the scenes. So I don't know if you wanted to share that or start that.
Yeah, I think we could get right into the video.
Lee, can you tell a little bit about your clinic?
Oh, sure. Sorry. So we are SoCal Vet Group. We are 3 hospitals located in Lake Elsinore, in Murrieta, and in Norco. So we are sister hospitals. We are fully merged. We have a staff of about 15 doctors currently, and we are growing tons this year. So we are always interested in working with teams like yourself, and we're looking forward to the event today.
Hey everyone, welcome. Thank you for joining us today. I just wanted to give a quick disclaimer before we start this video. Rusty is being seen for signs of pain. So with that being said, he is wearing a muzzle just in case for his protection and for our protection. Another disclaimer is that this video does contain blood and urine collection via needle and syringe. Rusty was not harmed in the making of this video. So first we talk to the owner and we get an idea of what's been going on with our patient. Rusty's being seen for painfulness. Next we go out and we get the patient from the owner and bring them inside. Don't mind the leash on Rusty's face. This is real life after all. After that, we bring them in and we get their weight. This is done for every patient. Next, we get a TPR. We obtain Rusty's temperature, pulse, and respiration. Dr. Austin begins her exam. She checks his gums, teeth, lymph nodes, eyes, ears, and then she begins to extend and flex his neck and turn it from side to side. She's doing this to check for any painfulness. Now she's checking his back end, his legs, his tail, just to make sure there's nothing funky. His hips, you can tell he is a little bit painful here. He does react when she's pushing on his back. Now she's checking his shoulders and front legs. She's doing the exact same thing to the other side as well. He wasn't showing us any signs of pains during that exam. Now Dr. Arthur is going to listen to Rusty's heart and lungs. The owner okayed diagnostics, so we are getting urine via cystocentesis with an ultrasound to allow us to visualize the bladder. Again, Rusty was a very cooperative dog. Next, we collect Rusty's blood from his jugular vein to complete our senior panel. After that, it's time for radiographs. Dr. Austin takes a look at the radiographs that her wonderful technicians took before we send them off to the radiologist. Now it's back to the car with Mom. Rusty has a little bit of arthritis and inflammation, so he is being treated with steroids for now, and they will talk about pain management further.
Thank you so much. So as you can see, the vast majority of the time, your animals are actually with our veterinary nurses. So they're really important in our hospital, and having a good veterinary nurse really is the key to any well-functioning hospital. Lee, did you have anything to add, or Sachina, anything to add?
I would just say, I think it's hard for people doing curbside because they do have to be separated from their pets. And so I think they should rest assured that we're doing the same thorough exams. The team is continuing really good patient care, and we're really focused on culture and values here. And so those things are very important to us. So I think you can feel very comfortable coming to your vet knowing that you're getting the same services, even pre-COVID, that were provided. So, and your teams are working really hard. As you can see, they're wearing all their masks at all times and still working hard as well. So good job to all the techs out there and nurses and doctors.
Great. And so I think what I'll do is just to tell you a little bit about our program. We do produce veterinary nurses, and they do get a bachelor's degree. And I'm just gonna show you, hopefully next year we'll have our pet spa day next year. And then we'll be able to see everyone back in person again. I think we are I just wanted to actually welcome Dr. Kessler. She is our dean, and she's been a great supporter of our program. So I wanted to introduce her before we went any further. And I think we were going to try to vote again for the pictures. So if people want to vote. And if in the meanwhile, if you have any questions for Lee we are going to have a panel in the next few minutes, but if you have any questions for Lee or Sachin about the hospital, please feel free to put it in the chat or ask them.
Hi, Joanne, and hi, everybody. I'm Melissa Watkins. I work with the Huntley College of Agriculture. And in terms of voting, number one, thank you so much for everyone for submitting your entries to the pet contest. And so what we're going to do is offer an opportunity for everyone to vote on the entries. And so here we go. I'm not sure if everyone is familiar with menti.com, but it's a fun way to vote. So if you are, you have your phones available, or even you can do this right on your computer, what you want to do is go to www.menti.com. So it's right there at the top of the screen. And then when you go there, you will use the code that you see here at the top as well. So it's 2022068. We'll take a few moments here to allow everyone to go and visit. But disclaimer, we will not share the results just yet. We'll be waiting until the end of the presentation, but want everybody to have an opportunity to vote now. So again, And when you go to there, you should see these pictures on the left. And there'll be two options for voting. One for the best pet photo bomb. As you know, we're all in this virtual setting, and sometimes our pets come and join us during meetings. And so some of our entries have captured those special moments. So that will be the first contest. And the second contest will be for our lovely pet photos that were submitted in various costumes and settings. And so you'll see there'll be two options for voting. So we will let you go there to, again, menti.com, code 202268. Please put in the chat if you're experiencing any difficulties with finding the link. I know this is maybe the first time you're using Menti. I have personally only experienced it once, and so I do find it to be fun, and I will use it forever.
Great. So while everyone is voting, I'm going to introduce Dr. David Driscoll. Dr. Driscoll is the newest faculty member, newest person of our team. He is a veterinarian, and he also owns his own practice as well. So he has definitely eye view of what's been happening the last few years. Dr. Driscoll is actually going to give a presentation on Valentine's Day toxicity. Can anyone guess what that is going to be?
Chocolate.
Yeah, it's gonna be chocolate, because some of you naughty people feed your animals chocolate, and some of the naughty dogs just take it off the counter. So we see this. So we're gonna give Dr. Driscoll the floor.
Okay, let me just try to screen share real quick. Hold on a second. And I'm actually a substitute teacher here. Can everybody see that now? Okay, cool. So I'm a substitute teacher here for this presentation. Annalise, one of our registered veterinary technician lecturers or instructors, was going to give this presentation, but she was unable to today. She did an awesome job on these slides, so I hope I can do them justice here. But yeah, like Dr. Sohn mentioned, you could also term this Valentine's Day toxicity because we see a lot of chocolate toxicity this time of year. And really, we see it kind of any time of year, really. We'll see it during holidays, you know, Christmas time, Halloween. One year, actually, it might have been even this last year, my wife was sorting out our kids' Valentine's Day candy, because she likes to save some of it. And I guess you can give it to the dentist and have the dentist can then, I don't know, they give you money for it or something. So she was sorting it out. She fell asleep. My dog counter-surfed and ate a bunch of chocolate that night. So fortunately, he's a 60-pound lab, and what he ate wasn't a big deal. But that it happens even to veterinarians too. So just, it happens all the time. Any time of year, we tend to see this. For some reason, the words aren't coming up here. I'm gonna just get out of this real quick. Sorry about that. I'm gonna just show it in this way, and it's not as good quality, but for some reason the slides weren't fully coming up. Okay, hopefully that's visible for you guys. So when it becomes toxic, so not every type of chocolate is toxic, and not every amount of chocolate is toxic either. So, and you can get varying degrees of toxicity from your dog based on how much they ate as well. So even something as small as a 9 milligram per pound amount of the chemical in chocolate that's toxic is called theobromine. So a small amount can cause symptoms like maybe vomiting and diarrhea, versus a large amount can cause, you know, heart toxicity. And although it's rare, it can be a life-threatening toxicity as well. So that happens at about 45 milligrams per pound. I'll show you a kind of a diagram in a second of the milligrams per kind of chocolate. So if your dog does eat chocolate, symptoms can happen within 6 to 12 hours. But don't wait to see if symptoms happen. We prefer for owners to call us right away if they've had any chocolate to eat. That way, if it's been within an hour, we can be very successful in treating it and preventing any problems from happening. So if you happen to see your dog eat it, give us a call. We're going to have you come in right away and probably make your dog vomit and just get that all up. So it's not even going to be a problem. And the reason why this is a problem for our pets is because they do not metabolize chocolate the same as we do. So the chemicals in chocolate, that while they're not harmful for us, they're very harmful for our mostly a dog. I haven't really seen cats with chocolate toxicity. It's mostly dogs. The classic problem that we'll see with chocolate is when dogs get into the unsweetened baker's chocolate. That's the stuff we get really worried about. Whenever we have an owner call us on the phone saying their dog ate chocolate, we always ask what type of chocolate was it? Because if it's something like white chocolate or milk chocolate, as you can see here, these are concentrations of the theobromine in each type of chocolate. So the very smaller numbers down here, like white chocolate and milk chocolate, the milligram per ounce amount, so the concentration of that toxic chemical in these chocolates is relatively low. But as you work your way up to the more purified forms of chocolate and even into the cocoa beans themselves, the theobromine is in very, very high amounts in those types of chocolates. It's pretty rare to have a dog or a cat eat cocoa beans or cocoa bean mulch. So really, or even the dry cocoa powder is just not that tasty. So the baker's chocolate is really what we're most worried about, because that, as you can see here, has a much higher number, 10 times the amount of toxin in the baker's chocolate as in the milk chocolate itself, or even the semi-sweet, quite a bit less. So when your dog does eat chocolate, we're going to ask some questions. So we're going to ask how much the pet weighs, because the toxicity is dependent on the size of your pet. When my dog ate some chocolate, I did some calculations and I know he was going to be fine because he's a 60-pound lab golden mix, versus if I had maybe a small 10-pound poodle, that amount of chocolate would have been a problem for that dog. So the size of the pet does matter. The type of chocolate, like I just showed you guys in that chart before, matters as well. Having some white chocolate isn't nearly as bad as eating baker's chocolate. So that matters, and obviously how much chocolate matters too. One of the tricky things we see is, was there only chocolate in what they ate? So there's other toxic foods that are sometimes paired up with chocolate. For instance, raisins, which we see that can cause kidney damage for dogs. Dogs will sometimes eat raisinets. So while we're not as worried about the milk chocolate and the raisinets, sometimes we're more worried about the actual raisins in there. And same with the macadamia nut cookies. So the white chocolate in there, very low risk of toxicity for the pets, but the macadamia nuts in there can cause some problems for the pets too. So it's sort of a double concern in that regard. So there's just an example that Elise put together. So if you, say you have a 9-ounce bag of Dove milk chocolate hearts. So again, there's milk chocolate in that. Thinking back to the chart, that's one of the kind of the lower amounts in there. And say we have 5 ounces that we put out into a small candy dish. If we have a 10-pound, our little 10-pound Yorkie, whatever it is, was counter surfing and got into that dish and ate every last chocolate piece in there, would we be concerned or not? That's oftentimes a call we'll get from an owner, is they have a Yorkie or a poodle that's 10 pounds. Hey, my dog eat all these chocolates. Do I need to worry about this or not? So we can either go back to that previous chart and sort of do the calculations and figure out, based on the size of the pet and milligrams at 8, or the ounces at 8, how worried are we about this? Or there's some pretty handy calculators as well. I'm going to pull one up here. So this is on Merck manual. You can look up these chocolate. Can everybody see that? John, can you give me a thumbs up? Okay. So we can actually very easily enter in, should we be worried or not? So right here, you can enter the pounds. So our dog is a 10-pound dog, and it ate 5 ounces of milk chocolate. And I put that equation in, and it says that this is a problem. It says emergency treatment advised. So even if for some reason you can't get a hold of somebody, or even our, out of veterinary practice, we'll use this as a tool to figure out, do we need to be worried or not? So, and if you bump this up to, say, a 50-pound dog, no treatment necessary for that same amount. So you can see that it definitely varies based on the size of the pet. So what does it look like for your pet if it's experiencing chocolate toxicity? So you may see, it's basically a stimulant for the dog or the cat. So you're gonna see restlessness, hyperactivity, it'll be more thirsty, it's gonna have some gastrointestinal symptoms, you'll see some tremors, maybe the heart will have some arrhythmias, the body temperature will go up, seizures. Those are when you get down to seizures, those are the more severe symptoms. And in rare cases, like I said, it can be a lethal toxicity for them. So what will we do? And by we, I mean RVTs. What are our RVTs going to be doing? So this is one of the very, very messy jobs that an RVT has to do. So you can see in the photo here, this dog probably was already made to vomit. And then all this black material here is activated charcoal. So we're going to induce vomiting. And if you ever need to go on a diet, if you're an RVT or a veterinarian, it's really easy to do. Just be around when you're making a dog that ate chocolate, vomit. The smell of vomit and chocolate, I can smell it right now. It stays with you. And if you ever don't want to eat chocolate anymore, just think about that and you'll stay away from it. So inducing vomit, get it all out of its system. Again, really effective. It's been within 1 to 2 hours of eating the chocolate. Activated charcoal is given to try to absorb some of the toxins. And then we're treating for any kind of symptoms that are coming up as well. And we really got to watch them closely. If it's a mild situation, we might send them home and have the owners monitor them. If it's more severe, we're going to have them in the hospital. And then if you want to screenshot these real quick, these are just resources for you to have in case you can't get a hold of a veterinary practice. You can call the ASPCA or pet poison hotline, helpline, and then you can click this link at your own risk. You can watch dogs that ate chocolate be induced to vomit. And I couldn't see the chat. So anybody have any questions about that?
I answered a question actually about what will the doctor recommend if we don't need any treatment. And I think Dr. Driscoll says, as you both know, they'll blow out with diarrhea. It's almost guaranteed. So it's not just, yeah, it's great. They're not gonna get really sick, but they'll have diarrhea. So just be prepared for that. So we typically recommend a bland diet, some liquids. And also the caffeine can cause them also to get very ill as well. So you need to be aware of that. Were there any questions for Dr. Driscoll? So I'm a teacher. And what does that mean? That means there's a quiz. So get your thinking hats on. And there's going to be a doodle poll. All right, see what you remember. Is the poll up?
The poll will come up when, yeah.
There it is. Okay. Ounce for ounce, which product has the most toxic to our pets? Unsweetened chocolate, cocoa, 100% cocoa powder, semi-sweet chocolate, or milk chocolate. So please choose your poll. Do we have an answer? Is everyone? It's anonymous, guys. I tell my students it's anonymous. We don't know it's you. I don't know if am I supposed to stop the poll?
No, we can. So there we go.
Sorry. Good job, 71%. 71% is cocoa powder, exactly. However, as Dr. Driscoll said, it's not very tasty. So it's really the baker's chocolate that can, honestly, I don't think unsweetened baker's chocolate is very tasty too, but dogs have the weirdest appetites. So we can't really predict what they'll do. Great. And the next question is, which product is not toxic to your pet? I think it's the next slide.
And we'll allow a few more seconds for answers.
There we go. Okay, so sugarless gum 20%, chocolate brownie 27%, cocoa Mulch 40%, and raisins 13%. So this is a trick questions. My students who are here will know this. It's actually, they're all toxic, or they all have the potential to be toxic. So even though they typically don't eat cocoa Mulch, I have seen crazy Labrador retrievers actually eat them. Raisins and grapes are also toxic. They don't quite know why. They don't know why. I mean, I've seen dogs eat grapes and never have a problem. I've seen dog eat one grape and be hospitalized for a week. And then of course the xylitol, somebody actually wrote it in the chat. That's very good of you. Xylitol is also it's toxic as well. And of course the chocolate brownies. All right, so good job. What is cocoa Mulch? Cocoa Mulch is what they put on the ground for landscaping. I don't know why they would use cocoa Mulch. As Dr. Driscoll said, if you've ever smelled chocolate and vomiting, you'll be immediately off it for the rest of your life. So I think that Melissa was going to give you another opportunity to vote for the Zoom bombing contest.
That's correct. We're going to allow for the second set of Zoom photos, but actually these are just I love my pet photos, and this is a set of photos with costumes and pets and also different backgrounds. So we'll share that in the Menti. And again, for those of you who have just joined, we have a Menti set up with www.menti.com. And when that slide comes up, we will have the code on there, but it is the code is 2022068, but we'll share that as well. So here we go. So when you go to menti.com, you will see this and you'll be able to see the photos that were submitted. I will say that if you did submit multiple photos for the same pet, like for instance, the lovely Foo, there were 3 entries. And so we picked one of them for the contest that you'll see here. But and again, if you have any questions about accessing menti.com, please let us know in the chat. But again, www.menti.com and use, it looks like the code is different for this one. Sorry, 265221 for this Menti. And Dr. Kessler did say that it's so hard to pick just one as they're adorable. That is correct. That's why we're making everyone vote on all of them. And thank you again for everyone who did submit entries and for all of you for attending today. And we'll allow a few more moments for voting on that, and I'll turn it back over to Dr. Sohn.
Thank you. So we're gonna just go into the little panel discussion now. I know that does everyone have a pet? I'm assuming you're here, so I'm assuming you all have pets. And I'm assuming you're spending a lot more time with your pets right now. And to be honest, they may or they may not be totally happy about you being home so much. So they actually had a study, just came out this month actually from a place in Spain. So in Spain, as you know, they did a really hard lockdown as opposed to here. And so in the study, they found that 70% of respondents felt that the presence of pets helped them during confinement. And I don't think that will be a surprise for anybody who has pets. What they have found is that dogs have increased vocalization, especially when left alone. I was wondering, has anyone seen that? I've certainly heard that in a lot of Zoom meetings. I've also heard, I don't know if you've heard this, I've heard that when one speaker has their dog in the background, all the other dogs start barking as well. So it's almost like a group effort. So they definitely vocalize more. And they can also be aggressive to other dogs on walks, according to this study. And that might just be because they're with humans so much. 11.8% of dogs' behavior was worse than left alone, which that actually shocks me. I thought it'd be much higher than that. There is something called separation anxiety that we'll talk about in a little bit. And then there's increased attention-seeking behavior from dogs and cats. Okay. And actually, when they looked at dogs and cats, they actually found that dogs apparently, and I don't know how dogs would report a quality of life issue to us, but they did. They said that when owners were too emotionally close, they are a little bit stressed out, and cats as well when it's a little bit too emotional. So I mean, love your pets, just don't love your pets so much. So I think really the key is to give the space. I know that the first time that when I heard about all the pets being adopted, my first thought was separation anxiety, right? Because and the reason why we got our pets is because, oh, I have all this time, I'm going to take care of my pet. So when you go back to work 10 hours a day, what's going to happen with your pets? So I am concerned that there's going to be a lot of returns or behavioral issues. So one of the things that they recommend with separation anxiety is to very slowly get them used to you being gone. Right. So what you can do is you can actually pretend you're going to go to work, get your keys, get your coffee cup, pretend you're going to go to work and come back 15 minutes later. Right? So you're desensitizing them. Like they're like, wait, I thought you're going to be gone for 10 hours, but instead you're gone for 15 hours. So you can just do that gradually longer over a period of time. So this will take some time. What you can also do is it's usually the first 10 to 15 minutes where dogs go crazy. I saw one of the entrants were of two dogs that ate the pillow. Was that person left alone? Were those dogs left alone? So what you can actually do, if you can somehow distract them in the first 10, 15 minutes, for instance, give them a puzzle toy, or sometimes you can give them Kong full of like frozen things, something that you can distract them. Oftentimes that will distract them from getting too destructive, okay? Because that's what animals do in their separation anxieties. They will become destructive. So what I'm going to do is, I don't know if Dr. Driscoll wants to talk about the state of, I think the question is, why does it take so long to see my animals at the veterinary hospital? The hospital that I work at part-time, it's not unusual for you to wait 5 hours to see us. So I don't know if Dr. Driscoll can give us the state of the veterinary medicine right now. And if anyone has any questions, please let us in the chat.
Yeah, I'm happy to talk about that. That's actually a good conversation to anxieties. One of the things we're seeing right now with COVID is people got more pets during COVID. And what I'm hearing from people right now is that, ooh, when I go back to work, my dog's gonna be lonely. I want to get another dog now to keep my dog company. So people got a dog because of COVID. Now they may be getting another dog to keep the dog company because of the separation anxiety issue too. So it's been a pretty rough ride through COVID, I guess I'll say. It's been pretty challenging, to be honest, just knowing what our staff are going through, RVTs, and even just support staff in general. It's been pretty challenging overall. At first, when COVID came, first hit, like everybody else, everything sort of slowed down. Practice got very, very slow. We were telling people to stay home, don't come in with your pet unless you absolutely need to. And as a result, most practices got, kind of for about a month or two, were very, very slow and not doing a whole lot. And then slowly people started doing more. And then they started getting pets, and all the stuff that had been sort of put off because we told people to stay home at first couldn't be held off anymore. So we had this like flood of people coming in to be seen. And as Leah pointed out from SoCal Vet Group before, we still have an obligation to provide, pre-COVID care for these pets. We can't let our medicine quality diminish because of COVID, but at the same time, we have all of these new guidelines we have to, abide by now with social distancing, reducing traffic flow, still trying to make sure we're seeing things that need to be seen. So, at the same time, everything is completely different within our practices. We have this like tidal wave of people that want to be seen, or pets that need to be seen. So, and with any kind of change, there's going to be some inefficiencies that are going to happen at first. And certainly while we were getting used to curbside, it was not very efficient, and we were not able to see as many patients at the same time as we normally would. And we just weren't really supposed to as well, to try to minimize people coming into contact with each other. So, practices were inefficient for quite a while, and still, I don't know if we're still up to speed. I think we're a lot better than at first, but we're still not as efficient as we used to be. There seems to be a higher pet population, and that seems to maybe even be growing as well also. And then some practices have had to close. Practices, we're not, we're working in close quarters. We are essential workers as well. So we've worked the whole time through COVID and that's come with a risk. And our staff, and I know RVTs, I know support staff, I know veterinarians that have gotten COVID, either, from working or outside of work. And with social, with social distancing matters, we have to work really close with each other. So when a person in practice gets COVID, that means, half of practice or more has to, go home and quarantine, or the whole practice has to close. So you're getting many practices that are closing. And so everybody needs to be seen from that practice is trying to go to other practices as well. So, it's been kind of chaotic, and it's still, is kind of starting to slow down now. But it's just been very, very busy. And that's sort of what on our end, what's been happening and what's been keeping, practices from being able to just get you in like we usually do. Wait times while you're there are longer, but even just getting in for like an exam and vaccine, sometimes you have to wait a week or two to get in for something like that, when sometimes you would be in the past, same day or at least same week. So it's just a lot to, a lot of protocol change, a lot of people, having their, pets at home. That was thought to be another factor, as well as people are just sitting at home, and when they see their pet having a problem, they want to bring it in, which we always have been advocating for. One of the problems we've seen in the past is people just aren't as observant of their pet because they're working or distracted in some way. But now that people are at home, they see a problem happening and they want to bring it in, which we applaud them for doing that. We would just love to be able to accommodate them, and sometimes we just can't now as well. So it's been kind of a crazy time for practices, and the staff has been, I would say, my staff in the staff as, other practices have been performing, top notch, really well through this. There's been a lot of adversity. Clients, unfortunately, have not been the nicest through COVID as well. They've been very intense at times and impatient with us, and unfortunately take it out on staff members sometimes. That's a difficult thing about, working in an animal hospital. But, my staff has been resilient. We've been even taking time to do more kind of personal care and have talks about self-care. And that's been helpful in my practice, and other ones I know, as well. Practice on the street for me, they've been doing yoga together and like trying to just do things to sort of like kind of feed their inner spirit as well, because of how challenging this has been. So that's my perspective on it. I'd be happy to hear from Lee or anybody else that has any input on that, or any questions about that.
Yeah, I agree with Dr. Driscoll. I think you hit kind of the main things we're also seeing, kind of mirrors what our experience has been. I think like you, we are focused on really trying to help with morale and keeping staff in a really good place. So we're just do some special events in-house. We're really trying to celebrate staff even more than before, to let them know like day by day, and we just got to keep tackling it. So we're really focused on keeping staff happy, and patient care. Clients, have been interesting for sure. So we just keep doing what we can do, and putting our best foot forward. So.
Yeah, that communication with the clients to let them know what, we're going through, and that we're trying and efforting, and these are, the steps we're trying to take, and trying to set the expectation so they know what's happening on our end as well. So I think that helps out with everybody just understanding each other and taking a breath and, working through it.
Yeah.
I did want to show everyone a little behind the scenes look. So at the clinic that I work at occasionally, it's a 24-hour clinic. And so it's an emergency clinic, it's fairly intense. So I'm going to show you something what we call a flow sheet. Every time an animal is hospitalized, they have a flow sheet with all their treatments that are given for this animal. So can you guys see the flow sheet? So this is a flow sheet of an animal that was hospitalized in oxygen. So as you can see, there's lots of stuff going on here, right? So they have, and this is the first page. I didn't even show you the second page. So they have 10 treatments, and they actually have more. This animal is being assessed every hour for his breathing. He's on 2 different types of IV fluids. And everything is documented. We have a saying in veterinary medicine that if you don't write it down, it never happened. So it's very important to be documented. So I just wanted to show you this, and because this is one of the reasons why things are so slow in veterinary hospitals, because I never do anything on this treatment sheet. right? Like the technicians do it all. I come by and I look at it and say, oh, okay, the temperature, he's breathing, not breathing great, and the temperature is this, but all this work is done by our technicians and our students, and it's a lot of work. And so if this is just one patient, we typically have 12 to 15 in the hospital. And the more, not all as hardworking as this, I mean, but some of them can be very, especially if you have a dog and parvo, some of them can be quite a lot of work. So this is what's happening. And this is one of the reasons why that things are taking so long. So they do really appreciate, your time. But that's also that's what's so exciting. This is what our students do, right? So our major is, I think, one of the only undergraduate major that's actually allowed back on campus this year. We had 3 classes last semester. We had 6 classes this semester. I will tell you, it's been incredibly stressful. And it's been a bit like kindergarten, because every hour we're like, okay, everyone, let's sanitize your hands. Let's wash your hands. We've also done the same lab 6 times, because instead of 24 people, we had to have 6 people. So it's been really interesting. And we have to wear face shields and masks as well. So it's been really interesting, but that just kind of goes to you how it's a very hands-on, and we always say that we embody Cal Poly Pomona because we are such a hands-on major. I'm sure you don't want someone to take blood from your pet or from you that's never done it before or only done it a couple of times. So we try to encourage our students to get as many opportunities to do all these hands-on work as possible. So thank you. Does anybody have any questions for the panel? We can talk about anything. But if you are, just one little piece of advice, if you are, when you do go back to work full time, you need to do it gradually. So please don't, for all of us, right? I mean, all of us are going to have to get used to putting on pants and things like that. So we need to be aware that we need to do things slowly. Don't do it all at once. So same thing with your pets. You need to kind of work ahead of time to make sure that they don't get too upset when you leave. Well, people think of questions. Should we announce the winner, Melissa?
Yes, and we have an opportunity for everyone to vote on the first photobomb contest again, because for some reason, Minty wants us to do that. So I'm actually going to, we're going to put that up again and have everybody vote. So here we go, www.minty.com. Use the code 2022068. So once again, we would like you to vote one more time on that first. The second one, we did get that one okay. So this is just the first one once again. That was a great discussion though, Dr. Sohn, that great panel presentation. And we thank all of you for your expertise. And as Dr. Sohn said, please, if you have any questions, do put them in the chat.
There was one question in the previously, and they said, do you feed your pet at the table? I think that was one of them. And I always tell people, if you feed your pet human food once, they will never forget that. So for the rest of their life, they will be begging. So just don't do it. Just fight the urge.
That's good intel. It looks like Dr. Kessler also has a question here. Do you have ideas on how to calm a nervous dog? And I need to put my glasses on because that was stressful.
Yeah, so I'm a huge proponent of drugs, but actually the question is, what is he nervous of, right? Is he nervous? For instance, there's another question about the fireworks. And the fireworks is definitely just drug them. I'm sorry. I mean, there's just nothing you can do about them. It happens for several days before and several days after, and these animals are just so upset. So I think that it really depends on what the animal is nervous for. But desensitizing is also really important as well. So if they're nervous of, brooms, you need to sort of desensitize them with the brooms. So a lot of it is just actually behavioral therapy. Someone mentioned a thunder vest. I'm so glad someone mentioned that. Yeah, there's a thunder vest that's out there. It's commercial, and it actually acts like it holds them. It kind of gives them pressure, And that actually has been proven to help some animals. So you may want to consider that.
I had a question about COVID. Can you hear me? Is it okay if I jump in? Yeah, I just heard that the new strain is maybe passable through our dog's fur. And so they should stay away from elders. And I'm sure you don't have an answer about that, but I was just wondering, like, what's your recommendation in terms of trying to get information about how COVID is affecting our dogs or pets?
So with the COVID-19, there's so many, unfortunately, because it's evolving so quickly and there's not a lot of peer-reviewed studies, it's really difficult for us to get an answer. They have found that cats can get it from us, but they're not sure if they can give it, they're not sure if they can give it to us back. So unfortunately, there's not a lot of studies on that, so we don't quite know yet.
Thank you.
Another question is there about a food question, like a natural wet food versus a regular? And I just said that this question about what to feed your pet is a 3-hour lecture. And it's just so complicated. I will just say that all pet food that's fed to a pet. So you can actually have pet food that's not ever been fed to a pet, and they can slap a label on it and say, here's dog food. There's something called AFCO. And AFCO actually, if you're certified by AFCO, it actually forces you to feed your dog food to a dog or a cat, and they certify it that way. So like I said, there's so many, this discussion is something that you should probably have with your veterinarian, but at the very least, make sure it is AFCO tested. And please, no grain-free diets for your dogs. No grain-free diets. It causes dilated myopathy. So please don't give your dog grain-free diets. And don't get your cats vegetarian diets.
Or vegan.
I can add to that. I had gotten a puppy and he was fed on grain-free and it just upset his tummy so bad. And then we changed it to the regular dog food, and it made such a difference. So he didn't like the grain-free anyways.
Yeah, it's it causes my ex-sister-in-law, a dog got dilated cardiomyopathy because of the grain-free diet. So it actually causes, they have a nutritional deficiency. And there's a question about cats. Cats are a bit different. Cats are something called obligate carnivores, which is they eat just meat. So I think cats still do eat a little bit of grain in their diets and their commercial diets, but in general, it's not the same.
Do you know why they're pushing now for grain-free diets? Do you know what the reason is?
Yeah, it's very trendy. It's kind of like gluten-free. Like, how many people in the world are truly gluten-free? Not many, right? It's very trendy. So people like corn-free also was trendy for a while. Nutrition is one of these things that's super complicated, but I think that people just like the buzzwords of, oh, we're grain-free, or, feed your dog's bone, or things like that. So.
Okay, we have winners ready. I know we're wrapping up the presentation today. So we have winners, and I believe we're going to have a special announcement. Sachin, would you like to do the honors on the winners?
How do I see who the winners are?
I put it in a private message in the chat.
Oh, okay. Awesome. Let me see. There's like 81 chats, so let me.
Right. There's the one that's in red.
All right. So photobomb was pet number 2. So number 2, pet number 2 won the photobomb, and then hold on one sec.
Look at that. And then just to pause here, that is Milo, submitted by Jennifer. Yay!
Nice. And let me see. Down here. I'm having difficulties. There's so many threads on this. Melissa, can you announce who won the other one?
Yes, we have Foo, submitted by Marissa, number 3.
All right, congrats, cute.
Hey.
Congratulations.
there were some great entries. We're really excited. We can circle through them all again if you want to say some closing comments at the same time.
Somebody also in the earlier said, how do I get my cat to go outside? And I thought, I don't know, they usually prefer going outside. So I'm actually kind of surprised that your cat doesn't want to go outside. So that's kind of surprising. If there's anything else? Oh, there's another one. What is the best way to bathe a cat? And Sachin said, just don't, right? So it's, yeah, bathing a cat, you take him to the groomers and you run as fast as you can. But yeah. And then what a great question is, how do I prolong my dog's life as much as possible? You know, we have done such a great job of taking care of our pets, the preventative care, the diets that we give them. One of the things you can do is, you know, catch things early. So after a certain age, we do recommend yearly blood work and urinalysis. We also recommend keeping them at a good weight. The number of animals we see that are overweight is a bit shocking, but unfortunately it does mirror our human as well. And it really is, especially if you have, you know, a cat that should be 8 pounds and they're 16 pounds, they get diabetes, they have to work their kidneys harder. So keeping them at a good weight, keeping them active, you know, doing preventative care really is the best way to keep them going for a long time. And bad breath. Yeah, bad breath. So some of you, if you look in your pet's mouth and it's really disgusting and dirty, there's nothing you can do about that except a dental, which requires anesthesia. What you can do after that is then you can start brushing their teeth every day to prevent it. But in general, what's already there is there. So it's really hard to get rid of that. So Melissa, I don't know if you want to have any closing remarks.
I just want to say thank you to all the panelists and participants today. It's always a nice way to connect, especially with our love for pets. And we really appreciate everyone sharing and participating. We can stay around a few more minutes too to answer some of the questions that were submitted prior to the event. And if you do have questions, please feel free to put them in the chat. We just want to honor U hours. So for those of you who don't know, our students have from 12 to 12:50 for U hours. So if those who have to leave, we want to respect that as well. So thank you so much. And we hope that you all have a wonderful Valentine's Day. Share the love.
Thank you, everybody.
Thank
Bye.
you.
Thank you, everybody.